Blocked tubes is one of the leading cause of infertility in the whole world. By the way, are you aware that several women do not have children, do not have kids, have failed to get pregnant just because their tubes are blocked? Do you know that you can do an HCG pregnancy test? The results come out negative, yet you are indeed positive, or yet you are indeed carrying a baby. All that in this video, plus several other questions you guys asked.
Ask Dr. Othman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if you'd like to have a private conversation and online consultation with me, go to my website www.drothman.com and make an appointment. And if you'd like to get information about us, go to all our social media platforms. The name is Ask Dr. Othman. You'll find us there. Today we are continuing with the questions you guys are asking, and if you'd like to be part of our videos, take a video of yourself asking that particular question that is itching you, then send a clip on our WhatsApp number which I have shown below. Let's start with this lady. She's saying,
hello Dr. Othman, Shakira from Lugazi. I have a problem. I've been following you for the whole of this year. My problem is I failed to conceive for the last 15 years. I've been in marriage for the last 15 years, but I failed to conceive. Doctor, when I tried making up a medical checkup, I did an HCG test and I was told that my tubes are blocked. They tried to unblock them, but up to now, no progress. I have one baby who is 14 years. How can I be helped?
for 15 years, this lady has failed to conceive. She has looked for the baby in vain. And what is the problem? Blocked tubes. What is this animal called blocked tubes? Let's first look at the first things. Number one, if you look at our uterus, it has the cervix, it has the fallopian tubes, and then the ovary. I told you that during ovulation, the egg or the ovum will move from the ovary into the fallopian tube. It will come at a place called the ampulla. That is somewhere in the middle of the fallopian tube. And then, when you have sexual intercourse with your man, he will deposit the sperms in the V. They will now move, traverse through the cervix into the uterus, and then they will be propelled to the area where the egg is, and that is the ampulla in the fallopian tube. Now assume that this tube is blocked. What will happen? Number one, either the sperms will not be able to reach the egg, or if it is blocked from the other end of the ovary, then the egg will not be able to move into the fallopian tubes. Just take it lightly, like when you're moving to town or you're moving somewhere and you find that the police has put a roadblock. You cannot pass. The same thing happens in our uterus. And therefore, that woman or you will never conceive if you are like that, except if there are some other solutions which are made available for you. So let's look at what is causing these blocked tubes. Number one, ectopic pregnancies. What are ectopic pregnancies? Ectopic pregnancy is a condition whereby the baby, instead of being formed or implanting itself into the uterus, it instead implants itself outside the uterus. So in this case, what will happen is that fertilization has occurred. Like I told you, fertilization occurs in the fallopian tubes. And then the baby has to be moved, it has to be propelled into the womb of the uterus, into the uterus. and then it is implanted there, it grows from there. So with this condition, what will happen is that the baby will not move away from the tubes, and therefore the baby will grow from the tubes. So whatever happens with that ectopic, whether it is done, whether surgery is done or medicines are done, because of course you can't have an ectopic pregnancy growing, especially in the tubes, growing to maturity or to viability. The baby cannot grow from the tubes, and therefore it has to be removed in whatever means. Now, whatever is done, there will be healing of that fallopian tubes with a scar formation. And when scars are formed in the fallopian tubes, then you may end up having a blockade. And sometimes if the operation is done also, it can lead to blockade of these tubes. Another cause can be the fibroids. I talked about the fibroids last time, and I said that these are growth or they are tumors that grow within the uterus. Now, if this fibroid grows near the fallopian tube, then it can cause blockade of that hole or of that fallopian tube, or both of them. And another issue is the PID, pelvic inflammatory diseases. I have talked about these diseases several times. These PIDs plus other sexually transmitted diseases, they can cause blocked tubes. Why? Because if they are not treated, they will block the tubes. 2, even if you treat them, at times they can heal with formation of scars. And when a scar is formed in the fallopian tube, it can lead to blockade of that particular tube. Something else we need to understand that causes blocked tubes is endometriosis. We said in the previous video that endometriosis is the growth of the uterine underlining outside the uterine underlining. What do I mean? We said that the uterus has 3 layers. The perimetrium, that is the outer layer, the myometrium, that is the middle layer, and then the endometrium, which is the inner layer. So in some women, this inner layer implants itself or grows itself somewhere else other than inside the uterus. We discussed about this. Now, if this happens in the fallopian tubes and there is growth of the endometrium within the fallopian tubes, of course, these tubes may be blocked. The last cause of blocked tubes I can talk about is the adhesions. What are adhesions? Adhesions are like threads which are formed in the fallopian tube. How do they come about? Take an example of a cobweb. When a spider passes somewhere and is entering its hole, it leaves a cobweb outside. And when flies or some other substances come, they are trapped from there. They cannot enter the hole where the spider is. The same thing applies to the fallopian tubes. When they are attacked by the adhesions, the sperm will not be able to enter, and or the egg will not be able to enter the fallopian tube. What happens exactly, or what causes these adhesions? They are like the pelvic surgeries. Pelvic surgeries like cesarean sections, cystectomies, and even appendectomies. So if an operation is done within the pelvic region, it can cause growth of adhesions, and if these adhesions happen or grow in the fallopian tubes, then you'll end up with blocked tubes. Now, how do we manage this? Because we are looking at a solution. This lady did an HSG. This is a very good starting point. What is an HSG? HSG is hysterosalpingogram. This is the best test someone can do to confirm that they have blocked tubes. How is this test done? This test is done by inserting or pushing a contrast or a dye into the uterus. After pushing a dye into the uterus, then you take an X-ray and see where the dye has stopped. That is where the blockade is, and therefore this is the best diagnostic test for a blocked tube or for blocked tubes. Now, once you have the diagnosis, what are you going to do? There are mainly 3 solutions. 3 solutions. Number 1 is fallopian tube recanalization. Fallopian tube recanalization. What do we do here? What the doctor will do is to get a speculum. A speculum is an instrument that opens your V. When your V is opened, it means we shall be able to see your cervix very well. I want you to be attentive here. If we see your cervix, then we get a cannula. We call it a cervical cannula or a cervical catheter. And then we insert it into the cervix. Of course, we shall be directed either by laparoscopy or we shall be directed by an ultrasound scan. And now when we insert this cannula or the catheter, we push it towards the end where the blockade is. And what will happen is that we shall push that substance that is there, that is blocking your tube, and it will go away. Therefore, the tube will be opened. How is this done? Let's take just a simple example. Most of you have sinks at home. When you're washing utensils and you realize that water is not flowing, water is not going, the sink is just filling up, most of you will bang the sink. And when you bang the sink, water will push. At times you can bang the sink and then it fails, the water still remains there. You will call your plumber. One of the things these plumbers do, they get pipes and then try to push whatever is blocking, because most of you put a lot of stuff in the, maybe in the sink or in the toilets and so on. So those stuffs can block the pipes and therefore block the whole plumbing system. And what these people do is to get a tube, insert it there, and then try to push those stuffs that are blocking the way. The same thing that is done when your tubes are blocked. We put a cannula there or a catheter there and try to push those stuffs that are clogging the way. Something else that can be done if we've not done the fallopian tube recanalization, we can do what we call salpingotomy. Salpingotomy. There are two words here. There is salpingotomy and salpingectomy. With salpingectomy, we are removing we are cutting out the fallopian tubes. That is not the desired action. The desired action is salpingotomy. In this one, we do an open surgery. An open surgery, we cut the way a cesarean section is done. We cut the abdomen, enter there, look at the fallopian tubes. Of course, we've already done the x-ray. We know where the blockade is. Then we cut there and open the tube directly after doing an open surgery. That is called salpingotomy. It can be done in the main theater. Another procedure that can be done is hydrosalpingolysis. Hydrosalpingolysis. This one is also done in almost a similar manner the way we do the HSG or the hysterosalpingogram. How is it done? Again, we shall get our speculum. I told you a speculum is that instrument that tries to open your V so that we are able to visualize the cervix. Now, when the cervix is opened, again we connect a catheter or a cannula. When we connect this cannula, onto a syringe that is full of fluids. There is a juice we make containing water, normal saline, containing antibiotics, containing steroids. That juice is made, and then we push it forcefully into the uterus. There is a certain measurement we make and push it forcefully into the uterus. Because we know the size of this uterus, we know the capacity of fluids it can take. Now, when we insert or when we push a fluid that is over the capacity of this uterus, we know that the fluid will pass through and enter the fallopian tubes. And because this fluid is pushed at a high speed, when it reaches where the blockade is, it will of course definitely push away the blockade and the tubes will be unblocked. However, when we are doing this procedure, the hydrosalpingolysis, we follow your fertile days, and therefore I cannot say that we shall do it on this day. It is individualized depending on the length of your menstrual cycle. We shall tell you that come on this day, either after your menstruation or even when you're still undergoing your menstruation. So the tube can be blocked and someone can have another baby. However, all the three can fail. We can do the procedure and then it fails, you still remain with blocked tubes. Actually, with hydrosalpingolysis, it is supposed to be done at least 3 times in different menstrual months. So if it is done 3 times and we still get a failure, then we now think about doing an IVF. IVF is an in vitro fertilization. I'll talk about in vitro fertilization in some videos to come, but this will now be the solution for you if the tubes have failed to open. Let's look at another person.
Good evening, sir. I'm calling from Nigeria, Sokoto precisely. Sir, I met with my husband on 27th of November and 29th of November, and I'm supposed to ovulate on 30th of November. Unfortunately, I took Postrino 2 because I'm not ready to conceive yet. So along the line, after for me to see my next period on this month of December 13th, but I missed it. I went for a lab test and they are telling me it's negative, but the urine test I did was showing positive. So I'm just confused because I have 2 daughters already and I wish to have a baby boy in my nest. Please advise me on what to do. Thank you.
So in summary, she's trying to tell us that she went to the hospital, did a pregnancy test, and they told her she was negative. But at home, she did the test again and it turned out to be positive. So what could have gone wrong? Number one is the timing. Because after fertilization, there is a hormone or a chemical that is secreted in the body. And this chemical is called HCG. This is the exact chemical that is tested for when we are testing for pregnancy. And therefore, if this chemical is not yet secreted in the circulation, then the test will always be negative even when you've already conceived. When is this chemical able to be detected in blood or in urine? After 8 days of fertilization or after 8 days of sexual intercourse, then this chemical can be detected. Actually, at times it goes to 14 days. Therefore, the optimum time for doing this test is 14 days. And the results you get at day 14 after fertilization or after sexual intercourse can be relied on. Another possibility that can happen whereby you do a test, it turns out negative, yet it is positive, or positive when it is negative, are the errors which can be done during the procedure. Like, let's first look at how this procedure is done. It is very simple. Even at home, you can do it. I know most of you have done these pregnancy tests. This is the strip. Okay? This is the strip. This is our HCG pregnancy strip. This is for the urine. If you look at this strip critically, there is where there is a mark and it is written max. So when you're dipping this strip into the urine, the urine is not supposed to go above the mark. So if you make an error and the urine goes above the mark, you may not get the right results. Your results may be negative or positive when it is the other way around. Therefore, make sure that when you're dipping this strip into the urine, the urine doesn't go past the blue mark. So this is how you are going to do your test. You are going to dip. I guess you can be able to appreciate. You dip and make sure that the urine doesn't go beyond the blue mark. Now, after dipping it into urine, you have to leave it to settle and then you read the results. However, this is now another mistake that can be done by you or any other person doing the procedure. You may read the results after 5 minutes. If you look at these test strips, actually you can read carefully there. They tell you to read these results within 5 minutes. So if you do the test and you allow it to settle there for very many hours and then you read after some time, then you may get wrong results. You are supposed to read these results within a period of 5 minutes. What are you expecting to see when you do this pregnancy test? You are supposed to see a strip coming out if you see two red lines like you're seeing on the screen, if you see two red lines, just know that that is a positive pregnancy test. But if it is one red line, then it is a negative pregnancy test. However, if you don't see any, if you see nothing, it means your test is invalid and therefore you ought to repeat it. And something else that can cause false positives or false negatives can be a contaminated sample. Your sample may be contaminated. And at times, let me tell you, there are some errors which can be made in the laboratory whereby urine samples are interchanged. We interchange the urine sample of a person who is not pregnant with a urine sample of a person who is pregnant. This is unusual, but it can happen, and someone will get negative or positive results that are contrary to what the person is. Another thing is an expired kit. When you buy your HCG pregnancy kit, please try to look at the expiry date. If you use a kit that is already expired, then you do not expect to get the right results. So if you want to get the right results, do the procedure well, use a kit that is not expired, and make sure that the sample you are using is the right sample. Now, some issue she's asking about, that she wants to have a baby boy. If you are already pregnant, then this is no longer possible, because the sex of the baby is already determined because you are already pregnant, as you are asserting. But if you are not yet pregnant, then you will be passing through the procedures, all the techniques you can use in order to get a baby boy you wanted. So what I would advise in this very particular case is that you should go back to the hospital and repeat the test to confirm your results, or else you can even change to another hospital or another laboratory to confirm that you are indeed positive. Something else you asked was about that you wanted to have a baby boy. Now, if you are already pregnant, then you cannot change the sex of the baby, because the sex of the baby is determined at that particular time fertilization occurs. So if you are already pregnant, the test result is showing that you are pregnant, you can now not change the sex of your baby. But if you are not yet gotten pregnant, then we will be discussing about this, how you can really determine the sex of the baby you want.
Hi, doctor. My name is from Ghana. Please, I had some measure problems. Measure disorder, because last month I had my menses on the 12th of November. Then I had it again on the 22nd of November. Since then, this month I didn't get my menses again, and when I went to do some scan, they told me I had a fibroid in the cervix, and I've been waiting till this month, till today. Still I didn't get my menses, so I don't know if there's anything for me to do for it to come, or I should wait for it to come by itself, because I've been wondering if maybe it can cause me any problem. According to the doctor, they said it's too small, like it's 2.23 centimeters. It's not too big like that, and I don't know whether I can get medicine and take for it to come, or if there's any help. If there's any help you can give me, so that I'll go through and then it will come, or I have to wait for it to come. And more is about this thing. They said is the fibroid is in between. Is intramural fibroid. Yes, they said it's intramural fibroid. So I don't know if there's best way for me to treat it. There's any herbs or anything medicine I would take to help strengthen the fibroid.
So if you have listened critically to this lady, she's talking about missing her periods and irregular menses. So these are one of the typical features of a fibroid. So if someone has fibroids, they can get those symptoms. Now what to do? Because you've already known that it is a fibroid, and good enough, You went to the hospital, did a scan, and it showed you that you have an intramural fibroid. You know, I discussed about these fibroids in one of my videos, and if you'd like to get the details of the fibroids, look for one of my videos talking about fibroids. You'll get the details. But let's understand this intramural. If you look at the uterus, I told you that the uterus has 3 layers. And it has the perimetrium, the myometrium, and the endometrium. So if someone has an intramural fibroid, it means the fibroid, or the mass, the tumor, is in between the muscles of the uterus. Now, my sister, what you're supposed to do is to make a decision on the 2 options. Number 1, the medical management, and secondly, the surgical management. For the surgical management, or doing a procedure, doing an operation to remove that fibroid, what we call the myomectomy, of course it's final because you go in, take out the mass, and then the fibroid will be gone. But if you don't want to go for the surgery, and probably you have your own reservations about the surgery, then you can opt for some treatments or some medications. There are medications we call gonadotrophin-releasing hormone agonists, and these include the dioprolide, the goserelin, the triptolerins. Look out for these medicines, discuss with your doctor, and find out if you can take them, because they also have some side effects and also contraindicated in some individuals. So talk to your doctor, discuss about this option. Maybe you can try those medications. But in conclusion, you should know that fibroids will not go away on their own. You have to act, either accept the surgery, that is the myomectomy, or you go in for the medications.
Hi, Dr. Othman. Greetings from me. Please, I just wish to find out how can I get pregnant. I watch your videos, and you know the videos are so good. Today, the 23rd of December 2020, my menses just started. My flow started today, so I wish to find out from this period, what are the exact dates from this period? How can I get pregnant from this period? Because I'm in a far distance relationship. My husband is in DC, so from now, the 23rd, I wish to know the exact period, from the exact date. How can I get pregnant as from now? Because he will be coming over for the weekend. Thank you.
Yes, our sister here wants to know her ovulation day and the days she can conceive. But I must tell you that I discussed about this topic. And therefore, I ask you to peruse through my videos. There are 2 videos actually. One is saying how to calculate my safe days, fertile days, ovulation day. And another one says how to calculate your safe days, fertile days in irregular menstrual cycles. Please check out those 2 videos. You'll get the description of what you want. But let me just give you a small pinch of what you really want. If you want to calculate your ovulation day, first of all, you must be able to count the length of your menstrual cycle. You must know the length of your menstrual cycle. And how do you calculate the length of your menstrual cycle? You do it like this. When you bleed, when you start your menstruation, you bleed today, you take it as day 1. Count day 1, day 2, day 3, day 4. I know by probably day 3, day 5, you'll have stopped bleeding. But you should continue counting your days until you see your periods again. So the days in between there, in between, like if you see your periods today and you see your periods again in another month or on another date, the days in between is the length of your menstrual cycle. And if you have an irregular cycle, you are going to calculate this, to count this for a period of 6 months. And the shortest length you get, we shall take it as the length of your menstrual cycle. So what will you do with the length of your menstrual cycle? Let's assume that the length of your menstrual cycle, after counting, the days are 30. The length of your menstrual cycle is 30 days. What you're going to do, subtract 18 from 30 days. So if you subtract 18 from 30 days, you get 12. So 12 will be the beginning of your fertile days. If you add 4 to 12, you get 16. Therefore, your ovulation day is the 16th day of your menstrual cycle. What do I mean? When you see your periods today, count day 1, day 2, day 3. On the 16th day will be your ovulation day. And therefore, if you met your partner on that 16th day, there are very high chances that you'll conceive. If your cycle is 28 days, subtract still 28 minus 18, you get 10. 10 plus 4, 14. So the 14th day of your menstrual cycle is your ovulation day. To get the details, please check those videos out about how to calculate your safe days. You'll understand everything. If you'd like to be part of our videos, please take a video of yourself asking that question that is itching you. Send it on our WhatsApp number +256 704 720 301. And if you'd like to have a private chat, an online consultation with me, go to my website www.druthman.com and make an appointment. And if you are watching this channel for the very first time, please don't forget to subscribe and press the notification bell in order to be notified of any video we upload. Thank you very much for watching Ask Dr. Uthman YouTube channel. Find us on all our social media platforms. Ask any question of your choice. We shall be right there to answer you. I sign out.
Ask Dr. Uthman on Masawa World.